If you're having headaches, it could be a sacral issue, especially if you're pregnant.
Does it make it worse if you could just keep popping the joint?
So seizure cases, autism, ADHD.
Hello, everyone. Welcome to Pregnancy as Critical Thinker podcast. My name is Caroline. Today, we're joined by beautiful Dr. Morgan of Truly Chiropractic here in Austin. She's going to talk with us about prenatal care, postnatal care, even pediatric care, and in general chiropractic care. And so, we'll ask all the questions we want to be answered, and let's have fun.
Dive right in.
Yeah, welcome, Dr.
Thanks
Morgan.
for having me, Caroline. I'm excited to be here.
Why am I so nervous?
I think it's, for me, it's the, okay, this is official. I got a mic, I got headphones, I got lights. I'm like, cameras on all angles. I'm like, this is awesome, though.
Good. So let's get into it. Let's first start. So you actually was my first connection in Austin. I literally lived, I don't know if you knew that, 2 meters behind your office.
Yes.
And I was like, I just firstly moved. I'm like, oh my God, I need to make network connections. And you guys were the first one I found on Google Maps.
Yep.
And I remember when I walked into your clinic, what should we call it?
I call it a practice.
Practice.
Yeah.
Okay. Practice. I was so in love with the aesthetic and the vibe. And I was like, oh my God, that's exactly what I want my practice to be. This is such like just family, and just it felt so warm. Everyone's so friendly. So tell me, I really want to ask you how that became to be.
Absolutely. So I actually started chiropractic school with a slightly different mindset and a different practice. I went to a chiropractor in high school, and it was a little bit more of, say, the typical, like, you kind of sit in a white chair, wait for your name to be called, and they bring you back, they close the door. It was a great experience.
Very,
I loved it,
medical,
but a lot more medical. And so that's really, when I started chiropractic school, I was like, well, that's what I'm going to do, because that's the only option. Well, my try two, so we have 10 trimesters in chiropractic school. So try two, early on, I heard my mentor still, Dr. Tony Ebel, speak, and he had the most crazy family practice playroom, mural on the wall, just a little bit more fast paced in the chaotic aspect of it. But it felt like the way he talked about chiropractic was community driven and family driven, family oriented, and not so you're going to be friends with your people. We're a part of something bigger than just you coming in and getting adjusted. So everything in my whole world just 180'd at that moment. And I'm like, that's what I'm going to do. And so I basically entrenched myself in learning every possible thing about that kind of chiropractic practice while I was in school. So whenever I moved to Austin, to Austin.
Where did you go to school?
In Dallas.
Oh,
yeah.
Okay.
So I graduated from the University of Texas in Austin, fell in love with it while I was here for undergrad, went back to chiropractic school, so lived in Dallas for 4 years, and I immediately was like, I'm going back to Austin. I'm like, it's a little, just way more my speed. And I was looking for a space, all that kind of stuff, but I knew I wanted open adjusting. I wanted you to walk in to our office and feel like you're walking into my living room, and that you could go sit on the couch and relax, get your kombucha, local businesses supported. We have, when you walk in, it's we love community connections. We love referring to people who are in our community, who are going to take good care of our people, you being one of the top on the list.
Thank you for all your referrals.
For sure. But
amazing.
It's I knew that's the practice I wanted to walk into every day and work at. I don't want to go walk into a white room, so I wanted music playing. I wanted it to feel like a safe space for me as well, and for my team, because that allows us to create a beautiful community environment for every single person who walks in. So that was really with my mentors kind of opening my eyes to the ability to have a practice like that. I took it running when I came down to Austin.
Yeah. It turned out absolutely beautiful. But
thank you.
Do you think it was, from what you're saying, it seems like not all chiropractors do that approach, right? That kind of more of a community vibe. Do you think it's because chiropractic is considerably newer doctorate area, right? They try to be like, oh, we're like very serious and you can't mess with us.
It's so fast. The whole history of chiropractic is a long story, but it actually was founded in 1895, and I don't know when exactly it became a doctorate, but pretty early on, like we were considered, started a doctorate program. Palmer was the first chiropractic school here in Iowa where it got founded, but I think, so it actually founded more in the principles that I'm talking about currently and how I'm practicing currently. And I think we lost our way for a while trying to fit in with the traditional like medical model. So I would say, I mean, it's a whole thing in chiropractic, but there is this like split way of like chiropractors who want to be accepted by the medical community and chiropractors who are like,
for the people.
Yeah. I'm like, I don't really care if your medical doctor likes me or not. Now we have great connections with medical professionals, nurses, nurse practitioners, all of those kind of things, OBGYNs. But, you know, the overarching theme in the States is something. So,
well, I mean, it's definitely changing. I feel like more and more of my clients like go to chiropractic, like, oh yeah, I love chiropractic care. It's the best. And even the fact that there's pediatric chiropractic, I think it shows the level of trust.
Yeah. I mean, we can be primary care, which is really incredible for a lot of moms who want to go more of the natural, holistic route. So yeah, I think we lost our way for a little bit, but I do think like the insurance really affected the chiropractic, I think a lot of professions. But whenever insurance came into play, we call it like the Mercedes 80s because all these chiropractors got rich off of insurance. And I think it pulled people towards like the back pain specific model and pulled a lot of people away from like the roots of it being a holistic health, like treating, in which we don't treat anything, but like old school chiropractors, they had like chiropractic hospitals where the worst of the worst cases were going and getting healed. Like it's a crazy, you'll have to look into it. I never
heard of,
Yeah, in Iowa. It was like the coolest stuff. Like the green books that they have there's so much cool research and like evidence for chiropractic, but it's just not in your traditional, you know, medical journal right now. We're working on it, obviously, as a chiropractic profession, especially in the pediatric world. But I think we lost our way for a little bit and we're coming back. So I think in the last like 20 years, there's been a big swing of chiropractors either leaving their like pain-based models and seeing more family wellness care. And that movement trickled into the schools. So I'm thankful I had a really strong community of people who wanted to practice like me while I was in school. But our class was like 140 people. And there was definitely like 20% doing peds, family wellness, 20% doing like sports, you know, 20% wanting to be more like PTs, 20%, you know, probably aren't practicing right now. Or maybe the other 20% are like maybe at the joint. But, you know, I feel like there's like a swing coming back into
more like preventative family,
and like what you can see in the pediatric world is just, I mean, and you know, it starts with pregnancy, starts with birth, and that's where like my mission is to change the trajectory of the future generation, and that starts with mom. That starts with preconception, that starts with pregnancy and how she walks into her birth, and that starts with that beautiful baby starting life and like a developing nervous system free of stress, which our world is very stressful. Birth, like the percentage of women who are having traumatic experiences in birth is so high. These babies are also experiencing that. And there's an epidemic at the end of the day with illness in kids right now. And a lot of people are ignoring it. So we're trying to do something about it.
So would you say what percentage of your practice is pediatric care at this point?
So our percentage is probably around 40%.
Oh, that's more than I thought. Okay.
So we see a ton of kids. Now we're probably like 30% prenatal. So we see a ton of moms who are pregnant.
So less than kids though?
Yeah, less than kids.
Is that because moms who have two kids?
Exactly. So mom's pregnant and then her two kids are under care and then the dad's under care too. You know, it's like we have a lot of full families under care. So yes, I think that's why pregnancy is less, even though we are focused on pregnancy as one of our specialties, but we end up seeing all of their kids as well. So it just obviously, and we see intense cases too. So, seizure cases, autism, ADHD, sensory processing, rare genetic disorders. So, at a point, moms stop having babies and still have kids. So I think that's where the inflation comes in probably. But yeah.
Yeah, they always mess with my statistics too, because when they come in, they're pregnant, and then they're not pregnant, they still come in, they're like, okay, you're
so it's like, oh, you're only 50% pregnancy. I'm like, well, I saw you during pregnancies. You kind of count as like, totally.
Well, so amazing. So, but when you were in school, for some reason I thought that prenatal and postnatal care is not such a choice for a future chiropractor, right? Like, how did you went into that? Just because you wanted to be family oriented?
You're exactly right. So and this is why I'm a big proponent of talking about finding the right chiropractor if you are pregnant, because we only get 3 hours of the totality. We're taking 27 hours every trimester. So we get 3 hours of a pregnancy and pediatric looped into one class in chiropractic school.
Whoa.
So obviously, like, anatomy is going to be across the board, some things like that foundationally, like your neurology, but like development of a baby, like the changes that happen in a woman's body while she's pregnant, hormonally, biomechanically, emotionally, are not taught at all in school.
It's so weird to me. I always I was doing research recently on social media about the spas, and like 10 years ago, they did not want to work with pregnant women at all in massage therapy. Now it's getting better.
Yep.
But it's so weird to me because women are 50% of population. Pretty much most of them will get married and will have a kid.
And get pregnant. I know. It's like a huge population of people you're not serving, or a huge chunk of a woman's life you're not serving.
100%.
And so, which I will say, there's chiropractors who are amazing and will refer out. Like, they've seen the woman during, life, and they get pregnant and they're like, hey, it's not my specialty, and they'll refer to us, which I appreciate because it is something we specialize in. So knowing that I wanted to be in like prenatal, really started family care, pediatric care, I was like, well, I have to know how to care for a pregnant mom as well.
So it was like a secondary thought.
It was almost a secondary thought at first, because my mentor, he's more peds focused, where we're a little bit more like family wellness focused. So we see a lot more adults and kids, and pregnant moms as well. But immediately, there's the ICPA, which touches on pregnancy, which is the Pediatric Association for chiropractors. So I took Webster, which I'm very fortunate that I was able to take Webster with Jeannie Ohm, who is the most incredible woman chiropractor when it comes to pregnancy and caring for women. Unfortunately, she passed a few years ago, but was able to take Webster from her. So that's unfortunately also like one of the only weekend seminar.
Weekend seminar? Okay.
And then you're Webster certified. So, I think a chiropractor needs to be Webster certified, but like your random chiropractor who took a weekend certification and is Webster certified doesn't necessarily mean that they know what they're doing when it comes. Yeah, they like know something, like more than nothing. And you do learn a lot at Webster, but like you don't get deep enough in a weekend to understand the totality of it. So that's what dropped me in. I got birth fit professional certification while I was in chiropractic school. So started learning from Dr. Lindsay. A lot of chiropractors I know ended up going through doula training just so they could get more education on like birth and pregnancy. Because our education is just lacking.
No focusing on that,
Exactly. I really hope in the future, kind of like the medical community has, you go to your initial stage of school and then you choose to specialize and then you get in, more specific education from there. But fortunately, that's not how it's going
so
down.
So now you kind of get a well-rounded, a little bit of everything.
Yeah.
So 2 years of med school and...
Yeah. And then you can, like dive deeper into your craft. But that's basically what I did on every weekend. Like in chiropractic school, I'm like, maybe I'm outing myself here, but I didn't have the best grades in chiropractic school because I didn't care about the PT class. Like I was like, I'm not going to fill my head with a bunch of like how to use this ultrasound machine when I'm not going to do that. Like I want to know more about neurology. Like I want to dive into the intricacies of what happens hormonally with a mom, or like, you know, when a baby's born, like the birth process. Like I didn't want to spend a ton of time learning things that I knew I wasn't going to use, because I'd rather refer out to the amazing PT who knows exactly what they're doing, who spent years in school learning their craft. So I spent all my weekends in seminars and like educating myself, reading books about things that I was passionate about rather than school.
I can totally relate to that. But I also think, like, I mean, massage therapy is such a horrible education in America. It's, I mean, like 3 weeks of anatomy. I'm like, massage therapy is all about anatomy. Like, you can't skip that.
I know.
But anyway, yeah. So I feel like if you are passionate, you have to, I mean, you probably will, but you still have to study on your own. Yeah.
Totally.
So I can definitely relate. And grades, I mean, we all know grades are not the most important thing.
No.
So yeah, as long as the your people are happy and get the best care they can.
Exactly. And you know, you have to pass your boards. Like, I mean, we had 4 rounds of boards and a PT exam. So like I had to know my stuff, but, it's like, you know, you have to make sure you use your time appropriately and not waste space in your brain for something you're not passionate about. But
amazing. Yeah. Well, incredible. And I know, your practice is, what I like about your practice is, besides that being postnatal, prenatal, pediatric care focus, that you guys focus a lot on neurology. Like I've known some chiropractors in New York, and they more, I mean, they were never proud of the fact that of what they can do. It was kind of just like come and go. I mean, as soon as you walk in, I feel like you guys are like, we're gonna like take care of you. We're gonna change your life. Yeah, exactly. Like even starting with the whole like scan and the beautiful picture. So was that just a clear image for you from the beginning? Is that like, this is what I want to do?
Absolutely. So I think the nervous system is also it's getting a lot more popular. Obviously, like people are talking about nervous system regulation and the vagus nerve and all of that, which is a new concept for a lot of people. Like they don't really know what their nervous system does. I'm like, it does everything. And so, and how that relates to what we do. So that is a huge part of our practice, and probably one of the number one comments we get in, like once they experience our day 1, day 2 is like, wow, I've never had a chiropractor sit down across from me this long and talk to me. Yeah. 2 is I've never understood why I was getting adjusted. Like people who've come from other offices, they're like, I've been getting like weekly care for forever, but I didn't really know why. Yeah. And like we pride ourselves on education. Like we want to make sure we answer all your questions. If we don't know the answer, we'll try to find it, or we'll tell you we don't know. Yeah. But the other thing is like, we want you to understand what's happening when you're getting adjusted. We want you to understand, and that takes time, obviously, but like we want to understand whenever your child has reoccurring ear infections over and over and over, and like we're trying to prevent tubes, what that process looks like of healing. Like we want you to understand why chiropractic and those chiropractic adjustments actually affects how the ear is draining, to allow your child not to have ear infections anymore. You know, we want you to get it. We don't want you to be like, and some people don't want to get it, and that's okay. But the opportunity is there, you know, because a lot of people don't, like, they'll be like, I got adjusted for forever, and I didn't know why. No difference. Yeah, it's like, I was felt the same, or especially with kids, they're like, I took, I was going to this chiropractor, and he adjusted my kid for free, but I never really noticed any difference, you know? And I think it's like, well, you're getting a free adjustment, so you probably didn't know what he was doing, or she. But, you know, also, it's like if you don't understand some of the things to look out for, especially with our wellness patients, we always tell them, if I adjust your baby from day 1, it's the things you won't see. It's the normal, happy, developing, beautiful baby that doesn't have any motor delays, speech delays, emotional delays. Like, they're going to have their, tantrums, and they're going to go through development, but they're thriving like humans, their nervous systems are in a thriving environment. So it's the things you won't see, which I think is really cool. And now I feel like I'm getting long-winded and I don't even know what the question was.
No.
But
I don't know. No, we're just talking. I'm just so fascinated because I mean, obviously, as we talked about, like babies are born, and then some women just don't even know if like something's wrong. Like should they get adjusted? So actually, that's a good question. Let's put it that way. What would be the reason for person like they never done chiropractic? They're like, should I try it? What would you say to them? Should I try it for myself, for my kid?
100%. So what I tell anybody who walks in our doors who's maybe never gotten adjusted before is, one, your nervous system runs the show. It's responsible for how you perceive, adapt, and recover to your environment in every single moment. Now, there's so much that's in our control, and which is beautiful. Like I live a very low tox life. Like I definitely do think like we cold plunge, we meditate, we pray. Like there's so many things that we do. Yeah. To like support our nervous system, outside of chiropractic as well. But so there's so many things that are in your control, but it's the things that are out of your control, the emotional stressors that you might experience, friends, family, past trauma, whatever it may be. So many environmental toxins and load that we're under currently. I mean, and that's something that's out of your control. You can control your environment, but you can't control outside of that. As well as physical stressors. We are all like on our phone, looking down. We're on our computer. We're slouching. We're in our cars. We're sitting. We're not like active. I mean, Austin's really active, but it's like we're not using our bodies that functionally on a day-to-day basis. And so all three of those things are out of your control and exactly what we can support. So if you're feeling like, one, you shouldn't be 25 and in pain. Two,
like, are there people who are 25 and in pain?
Yes.
Really? Okay.
So many people are walking into our office 25
I just
and in
turned
pain.
32 and I'm like, okay, now I feel the pain.
Yeah,
But
I'm like
before that, I was
31.
like,
I'm like, yeah, I maybe here and there if I sit too long, I'm like, okay, I need to get up and walk, or like I'm definitely like, yeah. But I think it's at the end of the day, your nervous system runs the show. So if you want the best possible adaptability and recovery to any stress that's coming your way, so that your spine doesn't create, so your nervous system basically creates these tension patterns, so we call them subluxations. It's really just like stress built up in the nervous system. We know emotional stress lives in the nervous system.
Colon, or what do you mean by build up? Build up of what?
Yeah, so tension. So you're basically these little muscles that are responsible for proprioceptive input up to your brain that are around your spine. They're not necessarily responsible for moving your spine, but they're responsible for sending feedback up to your brain at where you are in space. How are we doing? What are we perceiving?
Yeah.
And so if you are stressed, and it doesn't mean that you're mentally stressed all the time, but if you're physically stressed, chemically stressed, physically stressed, emotionally stressed, all these things, your body it has to put that stress somewhere. Like energy can't be created nor destroyed. It has to go somewhere. So sometimes it comes out for people as a symptom: headache, eye twitch, like restless leg.
Oh, I have that.
Yep. It's your body trying to get rid of energy. But it can't do it all on its own. So because we have an adaptability limit, we have a limit at which we're able to adapt to so much. And then we hit that limit and we start to create symptom. So what we do in the office is provide a way to relieve your nervous system and your spine, therefore your nervous system, of these stress points, these tension patterns, these neurological, like your nervous system is doing it for a good reason. But when it starts to get overwhelmed and stay there, then all of a sudden we're like, oh, I can't move, you know? So we provide an avenue to get rid of these tension patterns that are showing up, rather than, I guess like foam rolling. You're not going to get like the impulse to the brain. You're going to get the motor movement. You're going to like maybe hear a crack or two, and you're going to get that like joint moving, but you're not going to get that like fast twitch neurological input up to the brain to strengthen the pathway. I'm going one more point because it's so fascinating, but the way in which the the adjustment actually impacts the brain, I think is the most fascinating aspect of it, because it actually impacts the part of the brain called the PTO. And so this is the rational decision-making aspect of our nervous system. So all of a sudden, in the frontal lobe. And so whenever you get adjusted, one, your brain activity increases, and two, the area in which your brain actually increases in activity is your frontal lobe, and your, I think it's like, I'm blanking on what it's called, but PTO. But basically your PTO.
So right after you adjust, you should make decisions in your life.
Better.
Yeah.
Exactly.
Got it.
100%. And
judgment is better. Yeah.
Exactly. And it caps your limbic system, which is the older aspect of the nervous system that's a lot more emotionally driven.
Yeah.
And so you start making decisions better. Your life starts like feeling better. You start feeling calmer and like not as reactive because your nervous system isn't like PTO's off, limbic system's taking control because you're in fight flight.
Yeah.
So that was a really long, I probably wouldn't make it that long in a new patient appointment, but wanted to touch all the points.
Like sit down, I'll show you a video of explanation of everything.
All of this.
Like
this is what
lecture.
it is. Yeah, I'm like, I have a screen. Just listen to this.
Love
podcast.
it. You should just put a TV in the office and just roll in there.
Just loop it.
Explain it. Yeah.
Yeah.
Love it.
It is really fascinating though. That's new research that's coming out. So
yeah.
It's fascinating.
Oh, I love when like people like so passionate about things they do. I can see like you have like fire in your eyes. It's so amazing. Okay, so we talked about the nervous system and how it's related. So you definitely bring a whole different like aspect to just getting the crack out of your joints, which I think a lot of people think of chiropractic like what that is. Just getting the crack, feeling relief, and go about your day.
Yep.
But the question stands when we crack our fingers.
Yes. Oh my gosh. I had this conversation literally yesterday in the office.
I feel like everyone asks that question because it's like, what is the noise?
It's just air leaving the joint. Like at the end of the day, our joints fill with air. So that's why we say too, like you don't necessarily need to chase a pop to get like to get cleared out to get the benefit of an adjustment. And that's why some techniques are specifically like integrator, their activator, their instrument led techniques. We had that in our tool belt. We don't personally practice that way fully because I think there's also the motor component of a good manual adjustment that makes a huge difference. But with popping your fingers, basically it's just air leaving the joint. At the end of the day, people will say it gives you arthritis.
I think so. The guy proved it. He like was cracking like one hand for 30 years, and he said like no difference.
Yeah, there's no difference. The main thing people will say though is like you do want to try to prevent like jamming your joint. And so like coming in and doing more distraction type things with your fingers is going to be better. But I've been popping my fingers since the 3rd grade, and like I can't stop. Yeah. So.
Is it like almost like
I don't even notice. Yeah, it is. It's like I don't even notice that I'm doing it, but like it just happens because somebody taught me in the 3rd grade, and I've never been able to stop. But my mom took me to the doctor and was like, "Tell her it's going to give her arthritis." And so I think it just was a kind of like a maybe early 90s way of like trying to get kids to stop popping their fingers, saying it would give them arthritis. But yeah,
that's why they created Apple. No,
yeah, right. And I mean, movement is life. So, I mean, would you rather like have your fingers not being able to release, or would you rather have solid movement in your joints? I don't know.
Okay,
but maybe that's just coming from somebody who likes popping their fingers. But.
I mean, whatever you say, we believe you. So at this point, about the jamming, yeah, that's interesting. But wait, I had a question before that, and I forgot now. So obviously you said like it doesn't give you arthritis, but a lot of my clients, like we had discussion on this, and the picture in my head is if you crack a joint without releasing the soft tissue, it kind of pulls back. So it doesn't make it worse if you could just keep popping the joint and not do anything else? Or
great question. Okay. So it depends on what you're adjusting. So say the chiropractor who's looking more biomechanically at a system and kind of just like cracking everything. Okay. Like giving you like pain relief. 100%. They're like, obviously there's soft tissue components. There's muscle ligaments. I mean, all of you, this is your specialty. That's exactly where you live. And so massage is so important when it comes to that. But what we do is different. So we are looking at your nervous system. So we're looking at your body, yes, but we're looking at your nervous system. So we're clearing out things that are specific to relieving your nervous system and not necessarily your biomechanics. So that's where the like instrument adjusting comes in, similar things like that. So if we're clearing out your nervous system, who's to say that your brain communicating to that muscle and that muscle communicating back through the brain free of interference is not going to start to re-regulate and calm down.
Yeah.
And so if you're adjusting everything under the sun, 100%, like you're honestly, your muscles are probably gonna even be more upset because one, your brain has no clue where to put this energy, and has no clue what to do with it. But whenever you're coming in strategically on the points and the primaries that this person needs, then it's going to bring more synergy in with the muscles. And I know you believe this too, and you know this because of your education, but it's literally like the muscle isn't working on its own. The muscle is working through communication back to the brain through the spinal cord, you know?
Well, the
so
thing
you're
is
impacting,
yeah,
you know,
absolutely. That's why I want to say that when you say like, oh, it releases and sends kind of like back the signal that it's time to, you know, let go. I always told to my clients, like, it's, you know, release the muscle, but then your nervous system, if it remembers you being in a certain, it's like, oh, this is our normal state.
Normal.
Yeah. So we're going to go back to this. So I love that you guys actually reset kind of that connection. Then the muscle like, oh, maybe this is my normal, you know?
Maybe this is it. Like, this feels great. Like, I didn't realize. And that's where our scans come in, which I know you touched on, but we do nervous system scans in the office because we want to see specifically where your nervous system is dysfunctioning. We don't want to just like rack and crack you. You know, we want to make sure that we're actually providing value to your life and changing your life. And, you know, yes, maybe some of those adjustments are going to feel great in the moment, but they're not going to give you the long-term effect you're looking for. And that's where, you know, we do where education comes in, but that's where our care plans come in. Like, we want to create long-lasting change in the nervous system. We don't want to kind of just like leave you feeling okay when you leave. And then you're like, I don't really know like what that did for me, you know?
But do you feel, are there clients of yours or maybe like people who just come and go, who were so used to the regular approach of chiropractic, they come in, they're like, no, that wasn't the full service.
100%.
Okay.
Yeah. Oh my God. They're like, I still feel like there's a catch like right here. I'm like, well, we already adjusted there. And you're like, well, you know, the body takes time it does take time to readjust and re-regulate. We can come in and maybe like give you some relief that day in that area, but is that actually going to help your joint or hurt your joint? Like in what you're feeling that like system, or like, oh, I still feel like my pelvis feels a little bit wonky. Well,
can you do something about wonky pelvis? Because that's the separation, right? So if they have wonky.
Pelvis is a whole story, but I mean, the pelvis is so intricate, especially during pregnancy, which we can dive into that too. But, you know, at the end of the day, somebody might feel, I tell people sometimes you might get off the table and feel worse. Like, it's chiropractic, and what we do isn't always making you feel better. It's about making you feel. It's about making your nervous system actually understand that there is dysregulation here and this is not your normal. So me coming in on a joint that's probably been moved 1,000 times, it doesn't need to be moved because it's unstable, is not going to help you. If we're bringing balance and regulation to your nervous system, your brain is going to put information and it's going to realize that there's something going on in that area, and it's going to start self-healing and self-regulating. It has nothing to do with what I'm doing for you. It has everything to do with your body healing. So that's our focus, less on like current pain management, although yes, people come in and still come in for their pain, but we do try to get past that. Like, hey, this is what your body needed today. Maybe it's not what you think you needed, but this is what your body needed. And I guarantee by the time you wake up tomorrow, you're going to be feeling 10 times better than if I were to come in and adjust whatever it is you think you still need. So yeah, you know, it's a two-way street. We want to make sure that we're serving our people. And that's why education is so important. So they understand if we didn't adjust 10 different segments that they're walking out feeling clear. Yeah.
Mm-hmm. So is that why you kind of do, because I remember when I went to for my scan and stuff, the treatment plan, I guess it's very similar to a lot of people. You kind of do 3 times a week and then you do a couple of weeks and then you do like 2 times. So do you do that often just to retrain the nervous system? Is that the focus?
Yeah, 100%. And so what I will say too is we have some of our kids coming like twice a day for 2 weeks. So there is definitely like a scale to which we
wait, like every day?
Yeah. We have a beautiful case right now, but they're actually driving from Mexico to come see us. So they stayed for 2 weeks and got adjusted twice a day, every day while they were here, because their daughter was basically nonverbal autistic, kind of on the spectrum, wasn't really sure what was going on, started like very emotional. She is a twin and like developing very differently than her twin. Oh, wow. And wasn't speaking a whole lot, just like low tone, developmentally delayed.
What could have caused that in a twin situation?
I mean, if we want to, dive down that rabbit hole, I think, IVF is really common. One twin normally, one twin in general, twins, which twins are beautiful. Like Devin's mom's a twin, his grandma's a twin. We might have twins. But at the end of the day, normally in utero, one of them is going to be taking more than the other. So I think that's layer of it. Situation. Exactly. Also birth, normally twins are C-section, unfortunately. Yeah. And C-sections are beautiful in many ways, but they are a lot more intense medically, chemically, emotionally, and physically on mom and baby. And so we see twins normally have like a little bit more challenge because of one of that. And we're all different. Like at the end of the day, these were fraternal twins. So we're all different. We all have a limit that we have, and some people's limits are higher than others. Like there is that like somewhat genetic aspect of it, which I'm not a huge fan of genetics, but there is like some layer of that does play a role. Is like, why is this child developing normally and why is this child not? They're in the same environment. Who knows? It could be that she was more sensitive to one of the vaccines that she got and he was not, and that could be for many different reasons. We don't know, but she started declining and they were like, what the heck? This is crazy. So they found us through Instagram, because we do see, like I mentioned, more intensive cases. So they have an aunt who lives in Austin, came and stayed with her for 2 weeks. By the end of that, she literally verbally told her mom, like they almost, which is just kind of a crazy story, but they almost like got hit by a car on the way to the practice, and which is, thankfully they're both safe and like totally fine, but mom was upset and flustered. And normally, if you're, knowledgeable about kids with autism or on the spectrum, they aren't very like socially aware and they're not very empathetic. And so she literally looked at her mom and was like, "Are you okay, Mom?" And literally like right after that, they come in and get adjusted. And she was like, "You have no clue. Like she just asked me if I was okay, like for the first time ever." Yeah. So to say, we do provide the frequency for reasons, because we see the results with certain things that you're coming in with. So whether that's a child who is on the spectrum struggling with some intense trauma that's built up in her nervous system and caused her basically to shut down. We want to see your child twice a day for the next 2 weeks, because we know by the end of those 2 weeks, you're going to see a different kid. Wow. And that can be hard to sometimes believe, because it is intense. It's like, wow, I don't have time for 2 times a day for the next 2 weeks. But the value exchange that we give back for the time that you're committing to that is so worth it. Yeah. And we see it in the office. So, but yeah, some kids are 4 times a week. Some are 3. Sometimes we start 2. It really just depends on your scans, and the variety. Like, okay, this person's care plan could be 72 visits. Yours could be 12. We're not and some chiropractic offices are this, but we are not a one size fits all office. I won't even tell somebody that they're like going down to twice a week. They eventually, yes, but I don't want to promise something that like I'm unsure about until we sit down and look at your scans. I'm like, okay, we're thriving. Like, all right, let's go. Like we're going down. We're gonna like, cause the goal is that you hold your adjustment.
Yeah.
We don't want you to be coming and seeing us twice a day forever. Like we want you to hold your adjustment, start adapting to the stress that's coming your way, and creating an environment where you can go longer periods without an adjustment based off of the stress that you're under. So for me, I get adjusted twice a week. I'm under stress. I'm very physical with my job. We see a lot of people. I need that support. Whereas some people get adjusted every other week and feel absolutely amazing and don't feel like the need to come in more frequently than that. So it really just depends on the person. Yeah.
Okay. So I guess there are like ways you can help yourself to hold an adjustment? So just like limit the stress, cold plunging, I guess, right? Paddleboarding, whatever.
Yeah, absolutely.
Activities.
I always tell people like the 3 stressors that we talked about. So chemical, physical, emotional. You're going to hold your adjustment better if you can do good of those 3 things. Good food, good products, what you're putting in and on your body is good. What you're cleaning with, all of those kinds of things. Lowering your toxic load is going to help you hold your adjustment. You're under less stress.
Yeah.
Emotional stress. Be kind to yourself. And like affirmations, all of those things. Like doing things that are for you, the things that you love, paddleboarding, whatever it is that you love doing, do that during the week. Try to do one thing you love every day. And then physical stress. So moving your body. I tell people just walk. You don't have to be like, it doesn't have to be anything crazy.
Yeah.
But after the adjustment, we definitely tell people we want lots of water because we're moving inflammation around. We're moving joints. We're like, things are going to be flushing. So we want to make sure we're facilitating flushing things out. And then movement. Movement is life. Like sending positive feedback up to the brain. We want to make sure that we're holding our adjustment by sending that positive feedback from movement. And that's going to help you hold your adjustment because obviously the brain strengthens with movement. So, yeah.
I like that.
So that's why we tell people. And some people are like, I'm not going to change all those things, so they come in more frequently.
I like that they're honest about it too. Like,
they're like, yeah, I'm probably not going to do that, so I'll just come see you for boosts, like when I need it, because I ate too much like sugar last night or whatever. So now I have a headache or I had it, and they'd rather just come in and pay for the boost adjustment than change some of their lifestyle. But
you pick your own path.
Yeah. Absolutely. Teach their own.
Yeah. Well, tell me then, all of that, is that any different for prenatal care? Like when they are pregnant to come for adjustments?
Yeah. So pregnancy is kind of a whole nother ball game. We do scans during pregnancy as well, which is the cool thing about our scans is they're non-invasive. They're not putting in anything into your body. So they're completely safe for pregnancy as well as like a newborn baby, which is really cool. But pregnancy, we ideally like to see people at the beginning, like try one, which some chiropractors will say like, oh, we'll see you in your 3rd trimester.
Yeah.
But we're playing catch up at that point. Like you are obviously carrying some extra weight in a very different posture than our spine is even meant to be in for, there's lots of postural changes, lots of muscle tension changes, ligament changes, stress on the system. There's a lot of hormonal changes. There's a lot of emotional changes and there's a lot of physical changes. So we'd rather set a strong foundation and try one so that whenever baby grows and your pelvis starts to get stressed, it's coming from a balanced place. So we're not playing catch up in try 3 when you're already like sciatic nerve down the leg, can't walk, you're waddling and your pubic bone is on fire. And like, you're just like, I can't do this any longer, even though you still have 2.5 months. And so, or they're coming in like, oh, my baby's breached. And yes, like there's Webster technique is beautiful for assessing the pelvis, assessing muscles and ligaments that are coming in and attaching to the pelvis. But there is a point like if baby's not going to flip, baby's not going to flip. Like if baby wants to flip, he will, and we're happy to like help you feel more comfortable. But it's not a guarantee that just because we open up your pelvis, the baby's going to go head down at 36 weeks, you know?
And they can also flip like last minute.
They can. Yeah.
You
It's
never
like,
know.
exactly. They could be like day of, okay, like water's breaking, we're going head down, and we don't trust our bodies, I think, enough, but especially when it comes to pregnancy and birth. But so ideally we like to see you and try one. Honestly, most of our moms we see at that time.
It's because they were clients before.
Yep. So we see them come in prenatally, or they come in at the beginning. Yes, a handful of times we do serve the moms who are in their third trimester because they need support for sure. We're not going to turn anybody away, that's for sure, especially if they're pregnant. But we're playing catch up at that point. So it is a little bit harder for them to see the totality of benefit from being under care when we're really playing catch up with their pelvis has probably been dysregulated from you know,
second trimester, maybe earlier.
Yeah, I mean, the
women,
second they probably start showing. So, or like if they had intense morning sickness and were really nauseous, or like to the point where they were vomiting, like thinking about like that affects so much of your pelvic floor and tension and stress. Like if all that's sitting in your nervous system and your pelvis and your diaphragm, and then you put a growing baby on there and try 3, like it's a lot to make you know, a huge difference. Now 100% we see relief, but it's not the same as the moms we see earlier.
Makes sense.
They're not in pain.
Yeah.
So that's, which is really cool.
Yeah.
But
so would you say, so it's, I assume, I always, there's such misconception that massage in first trimester is like a super unsafe. You can't do it. I mean, even in massage school, they're like, oh, never massage like pregnant women's feet or lower back, which is pretty much all they want to get.
Yeah, exactly. Like that's what I need.
So would you say, is that the same in chiropractic? Like not a lot of chiropractors work with women in first trimesters, or is it
I
normal
mean, we are 100% all in. Like we will, we're 100% going to adjust you. Now we are more mindful when we find out, like we're a lot of the times first people that someone tells they're pregnant, you know? And so that's really fun, but we will, at the very beginning of it, we will monitor things or like change some things slightly, a little less, like we don't want to put anybody in intense rotation in their pelvis. We want to overwhelm their uterus. We don't want to like, I'm not going to be coming in and doing, because we'll come in and do uterine lifts on people who are on their period, things like that. So like, I'm not going to come in and like do all of that. Yeah, exactly. But I'm not afraid to adjust somebody, especially like we see a lot of moms who've miscarried several times, who are doing IVF transfers and wanting the best shot. Like, you know, I'm not afraid to clear out their nervous system and give them the best chance. But that comes from an educated place.
Yeah.
I know I'm not going to put them in some intense side posture that I'd put like, you know, somebody else in. I'm not going to come in and compromise their pelvis in a way that, which I'm not going to compromise anybody's pelvis, but you know, it is like, it's
a little more aware.
Exactly. Yeah. You're like, the moment that you know somebody's pregnant, it's like, okay, we're going to keep you a little bit more neutral today. We're going to unlock the nervous system. We're really going to come in on parasympathetics and like relax the system. So there are a few things that we tweak. And then as we get even deeper, we have pregnancy pillows. We use the drop table. So we're not going to put you in side posture. Honestly, if someone's putting you in side posture and they don't know what they're doing, they're putting you in like some weird, crazy twist. And I've seen some chiropractors doing that and like, late try 2, early try 3. And I'm like, no, that's one, there's like, everything's opening up. We don't want to create hypermobility. We want to create balance.
Yeah.
And you know, some moms will be like, oh, my sacrum, I just need it to pop. But I'm like, I promise we don't need it to pop to get the relief that we need.
Okay.
But yes, so not afraid. Try 1 is the best time to start chiropractic care.
All right, you heard it here.
Yeah.
So wait, we have time. Okay. So side position for adjustment in pregnancy is bad. That's the first time I'm hearing about it, because I feel like I had clients before, not with you obviously, but who've got adjusted that way during pregnancy.
Yeah.
So tell me then, I mean, obviously if they're in Austin, you should go to Truly, but if they're not in Austin, how should they choose
A chiropractor? I mean, for pregnancy, 100%, you can look on the ICPA and find somebody who's Webster certified.
Okay.
So it's ICPA4kids.org, and they have a directory that gives you any chiropractor in your area that is Webster certified. So they've taken that weekend seminar. So that's the first place you could start, is just confirming that they have taken that seminar, because that would be a good starting place for that. Okay. From there, I would make sure that on their website, like you're seeing mainly that they're family oriented. Like if you're seeing a chiropractor whose website is
injury, pain,
all that, then they're not specialized in pregnancy. They might see you, but they're not going to give you like the intense, amazing care that a prenatal chiropractor will give you. The other thing that I would say is, like, if they have Instagram, if they have photos, if they have anything, like if they have educational blog posts, webinars, whatever it may be, do they have anything in relation to prenatal that you can hear that the doctor knows what they're doing or knows, like, has some education on it? Okay. Do you see pregnant moms on their story, like on their Instagram feeds? Like, does it look like a practice that sees moms, you know? Okay. And not to say that there's chiropractors out there that are great, I'm sure. But it's not their focus. So I think if I was pregnant, I'd be wanting to go to somebody who was like specifically prenatal focused. Yeah. So finding somebody who has that as like a primary, not and we see pregnant moms, you know? So I would do that. Look on ICPA, then look through their website, Instagram. Do your search. Yeah. Get your search. See, really like see if the office vibes with you or not. And then go from there. But, I know we have a really amazing, which we can talk about it too, like birth, and chiropractic. We have a really amazing webinar on our website and social, all about how chiropractic impacts birth and specifically stalled labor. So like labor slowing down, any issues basically in labor that could show up, and exactly how chiropractic impacts all three of those things. So
impacting me in like when you are doing chiropractic from like trimester 1, what the difference between
birth
those
outcomes.
Cases kind of? Yeah. Oh, wow.
Yep.
Yeah. We'll link it. If you give me the link, I'll link it.
Absolutely. Here. Yeah. It's really cool. So yeah, we have a ton of information. Like you want to go to a chiropractor that has that kind of information, it's like, and there's,
are there any?
We do. But I mean, I think I would say there's some great prenatal chiropractors here in Austin. So like, yes, we are amazing. Yes, I agree. We are amazing, and we know what we're doing, but there are other offices in Austin that are great chiropractors who are also, you'll find those things on their website too. Yeah. I just wouldn't go to the person who's like pain.
Yeah. The flush words.
Yeah.
Okay.
Yeah.
It's actually so funny you said that check out their office. It's funny that you said that check out their office and check the vibe, because we actually had a question from Instagram and I thought it was hilarious. How to find a chiro that will have good bedside manners.
Yeah, totally.
So I guess that's a problem.
I mean, I think, chiropractors, we're interesting people.
Okay.
But I think it is. It's like not every person who's walked into our office is for me or for my staff, we're not for everybody. And so I think it is finding somebody that you feel like you would like, okay, I would connect with. Like same with massage. Someone's like, you're being very personal with somebody for an hour of their day, and like it's something that you want to feel comfortable and confident with somebody who's coming in on your neck. And like, it's like, there's a lot of trust that goes into that. And I think if your chiropractor is not being professional, like turn them into the board. Like, no, there's no reason why you shouldn't be professional in a bedside manner aspect. But if you're not connecting just personally with somebody, find somebody else. There's like, I think that's where, you know, making sure you're going to somebody who you feel cared for. Like, we're on first name basis. We like know every single person who walks into our office. Like, you know, it just making sure you're going into a place that you feel cared for, and you're not a number that's being like waited for, and they're pulling out a card to be like, oh, like Lexi, you know, and they don't even know who you are. So
but that's what I hear, like some clients, because I mean, chiropractic adjustment is still faster than massage, for example. So I'm there with you in an hour. I had clients, not it's rare cases, but like you come in and they seem super rude, but once you like must release something, they're like the sweetest person. We're like friends forever, you know?
Totally. We always like, we never judge anybody who walks into our office on day one. Because those people need chiropractic care. We're like, you need a good massage. Like, you know, you really needed like somebody to care about you. And somebody to like hear you, to let go of maybe some of the defensiveness you walked in with, you know? 100%. But I will say, in order to find somebody, pxdocs.com also, so we can put that in. So it's who we train with on a weekly basis. I guarantee every single person in that, like, we are
Is that like a association too?
It's a pediatric, so it's pediatric specific training program. So we train, I've been training with Tony for almost 10 years, but they have a platform that gives basically anybody who's training with them, and the environment's going to be very similar to what you're experiencing in our office. So that's a great place to find somebody who maybe has good bedside manner, because they're training. They're wanting to be better, and they're investing in themselves.
They're actually passionate about what they do and taking care of people and being in service.
For sure.
Yeah. Well, okay. So we answered that. Let's actually answer a couple more.
Cool.
I'm dealing with constant hip pain and discomfort after giving birth. I want to try chiro, but scared it will make it worse.
Girl, if anything is the most well-known thing when it comes to chiropractic, it's pain. I mean, like I said, we're not focused on pain, but we do see, like, if a mom, we're focused on moms, and we're focused on women. So obviously after birth, that's a big experience. Like, it's okay that you're experiencing pain, but it does not mean that you need to be in pain forever. So 100% chiropractic and pain literally go hand in hand. We're going to get you out of pain, and we're going to refer you to the right people if we can. We're going to evaluate you. We're going to know. And if you need to go to a pelvic floor therapist, because that could be another thing that's showing up with pain. We're also going to come in on psoas muscle, which is a huge part of pelvic pain, as well as your pelvic joint. Like, all this relaxin came into play, opened up your pelvis, and it has, it's coming back together, and it's re-regulating and coming back into play. Like, you might need a good hip distraction.
What is a hip distraction? Sounds fascinating.
Tug.
Oh,
yeah.
Okay.
So like a good opening of that.
Distraction is traction?
Yep. Yeah.
So, but just like a different traction?
Basically with a little bit more force, probably, is what I'm thinking. But I call it a distraction, as like there is a little bit more behind it.
Cool.
And
Another chirolingual.
Yeah. But 100% we can get you out of hip pain. Plus it's like a lot of pain is the nervous system not adapting and recovering to the stress that you experienced. Birth is trauma. A stress.
Could be trauma. Yeah.
I mean, even if it's the most beautiful birth and it's the perfect physiological, amazing experience, it's still a huge impact on your pelvic
100%.
region.
Yeah.
And I don't think we give it enough credit give our bodies enough credit or enough care in the US for those moms that are coming back into their body after having a baby. So
yeah, postpartum was like a whole different pain of mine. I'm like, why do we not have good postpartum care?
It makes no sense.
Yeah.
I mean, you have rehab for 6 weeks after any surgery, but like you have a C-section and they send you on your way in 3 days. It just is crazy.
It's insane, yeah. I mean, hopefully we're
changing it. Exactly. We're in it. We're going to change it.
Okay, so I've heard that chiropractic can help with headaches and migraines during pregnancy. Will my neck mostly be adjusted?
So great question. 100% we can help you with migraines, headaches. It is, again, one of the probably more well-known things chiropractic can help with. But the comment on will my neck be adjusted? So we are full spine. So the nervous system is the entirety of your body, and your spinal column is the entirety of your spinal column. If you're having headaches, it could be a sacral issue, especially if you're pregnant. If you're having headaches, it could be adrenal issue. Like your TL junction is locked up because of pregnancy and like the change that happens with the lordosis of the spine. So it's not always like your cervicals or your occiput, but we're 100% going to be adjusting your neck because there's probably there's probably all the things going on, but there's also things that can be happening in the pelvic region as well that are affecting the stacking and the biomechanics of your cervical spine. So 100% we'd be adjusting your neck, but we'd also be adjusting you full spine.
Yeah. Okay. I mean, so you would do the scan and kind of find out where it might be coming from.
Exactly. Yep. So that's exactly like, okay, are we fatigued out through our core? And that's what's causing like energy imbalance that's going up into the neck and compensation. Are we, like all of that's going to be playing a role. Is our sacrum like real off? That's causing foundationally challenge as we're moving through our day. So 100%. And that goes all the way down to kids too. Headaches is one of my first pediatric cases was a headache case.
Oh, there you go.
Yeah. So I'm super passionate about headaches and the fact that people don't need to be having headaches or migraines, and we have a solution. So come see us.
There you go. Yeah, come see Dr. Morgan and everyone in Truly. Now with 2 locations.
Yes.
2?
Yeah.
Or more? Okay,
yeah.
2.
Well, maybe I'll third in the future, but
in Austin too, though.
There's
just gonna cover whole Austin.
Yeah,
and
that's the plan. But we have potential of more south location. So,
okay.
Yeah. We'll see what happens.
All right. Crossing my fingers for you. Hope everything's going well. All right, let's do, I guess, one more question, and then we'll let you go with your beautiful husband to have a nice evening.
Thank you.
You're welcome. I'm worried about the safety of chiropractic adjustments for my baby. How do you ensure the techniques are safe?
Okay, great question. 1, this is why I wouldn't take my baby to anybody. 2, you want to be under the care of a trained pediatric chiropractor when it comes to newborns. Yes, their spines are obviously little baby versions of our spines, but they're
softer though, right?
Right, a lot softer. You do not need a ton of force. You need to make sure your chiropractor is educating you. It's so gentle and beautiful and easy.
It at some point.
Yeah, it's amazing. It's fascinating and amazing and beautiful, but the amount of force we are putting into your baby is so, well, it's scaled. Like think about if I'm adjusting my husband who's 6'5", I'm coming in like with a lot of force.
Knee first.
Yeah, a lot of weight is coming into those adjustments. For a beautiful newborn, precious little baby, I don't need a lot of force to make big impact in their system. Holding pressure points, little vibration is all we need to get the impact that we need to clear out their nervous system, and you'll see it happen on the table. So 1, it's 100% safe done by a trained pediatric chiropractor, because you'll see it. There's a million videos of us adjusting babies on our Instagram. It's so gentle. It's so amazing and precious and beautiful. And like literally these babies have smiles on their faces, or they go from crying to literally just like so relaxed. Like it's just is like, I could not even think of one case of a baby getting injured by a chiropractor. So
amazing.
Yeah.
Wow. Okay. Definitely take your baby to chiropractic.
Yeah, 100%.
I love that you work with babies because I don't know if you knew, but back in Russia, I wanted to be pediatric doctor. And I love that I picked that field because kids can tell you what's wrong.
Yeah.
So it's almost like you have to figure it out and you have to make sure they feel good, but they give you those nonverbal cues. They're so telling.
They are. Yeah. That's the thing that's beautiful too about kids and babies. They don't have that mindset. So like they don't have the limiting belief that like, there's still something there, or like, I don't know if this is working for me. They heal so fast because their mindset is not limiting them from healing.
Yeah.
So you're going to see it quickly with a baby. You're going to see them change really rapidly. And I'm actually doing a webinar next month, so launching in July, that is 5 reasons to take your baby to a chiropractor and educating as to why.
Oh, cool.
So that might be a great webinar for this person specifically to listen to get a little bit more, because a lot of it is like this trust too. It's like, it is like taking your baby to handing your baby over to anybody is hard.
Yeah.
And we don't take that lightly. That's why, hey, we'll adjust baby on your chest. Like, we don't need to take you away from baby.
That's so cool.
Yeah. Like, if you want to lay him down because you want a second and you need to go to the bathroom, like, we'll also hold your baby too. But, you know, like, sometimes it's like, hey, I don't want, like, I need to feel safe here. And like, we will always make you feel safe and comfortable and confident with whatever we're doing. We're never going to do anything you're not comfortable with.
Yeah.
So making sure your chiropractor feels that way too.
Yeah.
But
There you go.
yeah.
Well, that's definitely a different approach to chiropractic care, because it kind of breaks all the stereotypes of they're going to hurt me. It feels so scary. I'm afraid.
No.
It's probably not going to do any good for your nervous system. So
No.
definitely find someone who knows what they're doing.
Oh, 100%. Like, if I'm forcing you into something that you don't feel comfortable with, what am I doing to your neurology?
Oh, yeah.
Like, I'm not supporting your neurology. It is a two-way street. We are here for each other. I am not here to force you into something you don't want. And I'm also going to tell you when, like, hey, we need to do some things, but I'm going to talk you through it first. And I'm only going to do it if you feel comfortable and confident.
Yeah.
I'm never going to like push past like the nervous system saying no, you know?
100%.
So, yeah.
Well, I can tell from my personal experience when I went to see you guys, I think I got adjusted by you once or twice. But I mean, as anyone would, you get so nervous when someone about to adjust your neck, because like, it's coming, it's gonna feel weird. Like, but Dr. Morgan personally, she's so gentle and like very slow and like even touching you. So you're kind of like, oh, okay, like this is okay. No one's gonna hurt me. You know, it's so like gentle and caring, and I feel like that's what you need to look for. Someone who's like
intentional. Yeah. Very intentional about where we're coming in on and working together with you and your nervous system and being, like in tune with you, I think is really important. Yeah.
Well, amazing. So I don't know if we, so I guess that's about it for today.
Cool.
I feel like I could go more, but maybe in a year or so we'll meet again.
Yeah, for
we'll
sure.
Talk more.
Let's do it.
Tell me, remember I to ask you about the gift thing. Do you want to?
I mean, we have a lot of, what we can do is offer, our new patient fees are actually going up in July, but what we can do is anybody who mentions the podcast, we'll give them our old fees.
Oh, how cool.
So we can do something like that. And so it gives them like a little, and then plus we have the dystocia webinar, I think would be a great resource, which we can send out that guide, or if they want to watch the newsletter, that's all free already on our website. But I feel like that little gift, if they wanted to come in.
But there are a bunch of people who are not from Austin, unfortunately.
Yeah.
But for them, I guess we'll link all the webinars in. You can listen.
Reach out to us, and we can find somebody who's in your area too. We have a vast network of chiropractors all over that I have great relationships with. So
I need to do that for my specialty, because people ask me like, I have no idea.
Yeah. People I trust and like know. And if I don't have somebody, and sometimes we don't, but we do have a pretty large network that
that's amazing.
I can support the community with.
That's good.
Yeah.
Well, amazing. Okay, so we'll link everything below. Definitely follow Dr. Morgan and Truly Chiropractic on Instagram. They post a lot of really cool stuff and all the notifications about the webinars they have coming up. And maybe you'll be lucky enough for Truly to open in your town someday.
Yes.
So, but thank you again so much. It was such a pleasure. I'm so happy you agreed to do this.
Thank you so much for having me. It was so much fun. So I'm looking forward to more conversations in the future.
Yes.
On and off the mic.
Yes. Yeah. Thank you.